guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to nurses who want to become medical coders. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. Now, the reason that I'm doing today's video is because I've gotten so many email requests lately from nurses who say that they are wanting to make a changeover from like the hands-on patient care side to something a little bit more behind the scenes. So this video is for you. All right, if you are wanting to be a medical coder, and I will say this first, and I'm going to leave some helpful videos that I find helpful, the ones I've done before, and I will leave them down there. I hope that you will take the time to go through them whenever you do have some time, because it's a lot of really good information. But if you're wanting to become a medical coder, you have to make sure that the program that you are sitting for is preparing you for either the American Health Information Management Association credentials or the American Academy of Professional Coder credentials, all right? One of the two. These are the two major medical coding association powerhouses, and their names are very reputable. If the program that you are going through is not prepping you for one of these credentials, I strongly recommend that you reconsider and really consider going with AHIMA or AAPC. Either one is fine. And so it's entirely up to you, but that is just my first bit of advice. The second bit is I have trained nurses for many years in their nursing capacity to help with the documentation with the provider, or I have trained nurses who this is their first job as a medical coder. And there's two types. There's the type that really wants to learn, is very engaged, and is always asking questions. And then there's the other type that is very dismissive and that they know. And they know and they've done coding before. But their version of coding is like a sheet that has like a bunch of commonly used codes, and they're selecting codes. And they feel that that is coding. That is not coding. That is code selection, okay? And at that, it's not true code selection, right? Because true code selection is really looking at the documentation, interpreting it, and selecting the codes from like the encoder or the book, okay? That is true code selection. Coding from a commonly used diagnosis sheet is not code selection. The second thing is, the great thing about nurses is that they already have a background in medical terminology, anatomy, and physiology. So you're really good there. Now, a lot of times, especially for coders who have no medical background, that's a struggle. And so you're already ahead of the pack when it comes to that. So there's certain things that you're not going to have to go over. I mean, obviously, it's not going to be very difficult for you when you are going through a program for your certification. As far as if you should go for a degree or should you just go for the certification, I always recommend going for the certification. The only reason that you should go for a degree in the beginning is if you want to do something on the managerial side of the house. The RHIA, which is the Registered Health Information Administrator, is offered with the American Health Information Management Association. This is the bachelor's degree, okay? This designation comes from AHIMA, and this is a bachelor's degree. So if you are insisting on going into a college program and you want to get your bachelor's degree, that would be if you are wanting to run whole departments and hospitals and things like that. That's what people who have those type of designations, that's what they do. They don't really do a lot of the coding side. They're more of the managerial side of the house, and they make the executive decisions. That's what they do. To have that and to be a nurse is a pretty good resume. It's the start of a pretty good resume. So that is good. If the RHIT, which is the Registered Health Information Technician, that is going to be undergoing some changes here in the next few months. And so I'm going to have to do another video about that. But that is the associate's degree currently. And with that, again, it's going to be more of the supervisory side of the house. And they're going to be working with the coders, and they're going to be doing lots of education with them and things like that. So if that's what you want to do, just understand that that is what those designations are meant for with the degree programs. Like I said, If you're just wanting to be a coder, then just go with the credentials first. Go with one. Don't get a bunch of credentials thinking that it's going to make you look really good or put you at the head of a pack when it comes to getting a job. Well, Blue, I'm a nurse, so naturally they're going to want me. Well, a nurse, again, at the same time, they're going to ask you, have you had hands-on experience with applying codes? And selecting codes from a pre-selected list is not the same. So you can't really do that. And you can't say that you have any experience coding. But what you can say is those transferable skills that you've had as a nurse, which is working with the provider and, making sure that the documentation is clear, especially whatever the nurse is responsible for documenting. And so there's all of those things that can be transferred over, and where a lot of times nurses are, especially when employers see nurse and medical coder, they get very excited because they say, okay, this is somebody that is knowledgeable about how the record should look. If there's anything missing, the nurse has the technical ability to be able to catch that. And so they would put you like in a position of a clinical documentation improvement person, okay? You don't necessarily have to have the credential for this, although it does help to have the training for it. It is a very worthwhile position because you do work directly with the providers. And being a medical coder does not preclude you from working with providers, because you will have to work with them. The great thing about nurses is that you already have an established rapport with providers, because you know how to communicate with them, or at least hopefully you do. But working closely with providers is a good training ground as a nurse before you become a medical coder. And a lot of times doctors will, be very happy because, okay, it's somebody who's had training before in medical, so they know. With medical coders who have no previous background, a lot of times doctors will say, I'm a doctor, how dare you question me? But then sometimes if it is a nurse who has had all of this education, and so they're more likely sometimes to take, them seriously from somebody that is, having to literally train themselves, or having to get training in order to get this same level of, okay, we've got the same level of respect. So it just depends. But being a nurse, this is going to come in handy because you know their temperament, you know what they're like. And with medical coders, it's a big hit and miss thing. Some medical coders are very hands-on, others are very hands-off, which I think that if you are a medical coder, you should always be hands-on. There's really sort of no excuse, unless it is a thing about in your facility that you do not communicate with the providers, which again is a really bad thing, because if you are the coder, you are going to know firsthand the provider's habits. And so it is important for the coder and the provider to have a really good relationship, so that way they know what is going on and they can talk to each other. Okay. And if there's stuff missing, it'll come out. But yes, it is really good for nurses to transition into this. But sometimes some people have asked me, well, I've been a nurse for 20 years and I just want to work at home. So can I just get a job at home? Right now, because we're in a pandemic, it did change the climate a little bit as far as working remotely if you're a brand new medical coder. If you are applying for a place that you have to physically go, 9 times out of 10 right now, they will send you home, okay? But don't expect to continue to be at home once, more restrictions are lifted and once things go semi back to normal. Don't expect to continue to be at home. They may have you go back to the facility. And this is because if you are trying to apply as a brand new medical coder and you're trying to apply at remote coding companies right now, they're going to tell you no, because typically remote coding companies want medical coders to have experience before they are at home. Now, I have seen nurses really struggle to understand the basic principles of medical coding. And I've had some very dismissive nurses tell me, oh, I can get this, it's no big deal. And then, you know, it wasn't too long after that they said, wow, I had no idea how hard this was. This medical coding is not a joke. It is not easy by any means. And it is about interpreting the documentation and making sure that everything is there and supported. And it has to be supported in a way that is very clear. It can't be just, well, I know that he has this elevated rate and this elevated rate and this elevated lab, and so that means this. That no, if it's not documented, it didn't happen. So we can't assume anything when it comes to what diagnosis we are selecting. Every diagnosis, every procedure that we select has to be supported. And it doesn't matter who's doing the coding, you know. But one thing I will say is this. If you are a nurse and you decide that you want to become a medical coder, it is okay to reach out to your fellow coders once you start somewhere and ask questions if something is not clear. Just because you have lots of education, sometimes I've seen nurses struggle to ask for help. And when you are a medical coder, it is a team sport. This is not something where, you know, if you don't understand something, then you're magically going to understand it the next day. You're not. You really do have to have somebody explain things sometimes. And sometimes you can start to, once you start to learn how to study for it, and once you start to learn how to find the answers, it will be easier for you to get the answers and sort of start to figure it out after a while. But in the beginning, you really do have to make sure you know what you're doing. And so asking lots of questions is key. And having that sort of being, well, what's a good word to say? Being okay with asking questions. You know, like I said, I've come across many nurses who just could not ask questions. And they were like, well, you know, I have all these degrees and I have a bachelor's in nursing and I'm asking somebody that only has a credential. Yes, but I love my job and I know what I'm doing. And that's the difference there. And it's not just I'm not just a check the box type of person. I am a details person. And that's what you have to be when you are in this field, is that you have to be very detailed. So if you are very detailed and you like looking through documentation and reading, and you're going to be spending hours a day reading, that is 90% of what we do. The other 10% is communication with the providers. Or if you are doing the billing side, it is going to be with the insurance companies or with the patients over the phone, right? But if you are just wanting to do this to switch it up, it is a great career. It is very solid. It is not going anywhere. And despite what anyone says, it is not going anywhere. Yes, there are advances in technology like artificial intelligence and things like that. And you may hear, well, you know, after a while it's going to be that the provider can speak into a thing in a program and it's going to give all the codes. Wrong. We are light years away from that sort of technology. That is very advanced technology, and we're nowhere near that. They've had different programs that will say, well, you know, we can select some of the codes, but it doesn't have the ability to be able to reason, right? And all a computer software program is looking for is words, keywords, and that's what it's looking for. And when you have something like that, that is not as reliable as a human eye. So, yeah, there's really no need to worry about that. And we've been being threatened with that for years. And, you know, we're still doing good. If you're concerned about work being sent overseas, I've talked about this many times before. The problem with sending work overseas, like medical coding, because this is a field that is majority of reading comprehension. When you have people who don't speak English as their first language, it is much more difficult for them to understand, let alone people who do speak English, right? And so sometimes there's many errors, and that work has to come back to the US and has to be recoded by an English-speaking person who can read it and comprehend what's happening and then be able to apply the codes. So that's not something to worry about either, because it happens in waves, and sometimes it does seem like it comes up a lot, but then it just comes right back because of all of the errors. And not to say that all of the foreign companies do lots of errors, but the chances of errors is high because English is not their first language. And when you have doctors who speak in their own language, because we all know medical terminology is completely a different language. You know, people say that, oh yeah, I'm bilingual, and they think, oh, because maybe they speak English and Spanish. I say I'm bilingual because I speak English and medical terminology. But that's just me, you know. I think that, and well, I think I would probably speak 3 because my Spanish is very rusty. I don't have people around that I can speak Spanish to, so when you don't get to speak it all the time, it just sort of gets out of the way. I know, get back to the point, Bloom. All right. But it is a great field, and I love it. I mean, I came in with no medical background. I have no medical background at all, but I do have lots of experience in different clinics, and I have lots of experience with different personalities, and whether it is with providers or with nurses. You know, that is what it is. So yeah, that is my advice. And I will be doing some more job listings explained videos, and I will probably pull some that they're asking for a nursing degree as well, so that way you guys can see, you know, what sort of things they're going to ask you for once, you know, if you decide to get your medical coding credential and then you get into the field, what can you expect and that kind of thing. So that's it. That is my advice. So I'm going to go ahead and wrap this one up. If you have any questions, comment below. You can let me know, and I'll probably tack them on to Q&A Tuesday. Q&A Tuesday airs every Tuesday. It is the #1 question and answer show about medical coding, airing on Tuesday. So I hope you'll catch my videos then. I hope you'll catch my video then, and I will go ahead and wrap this one up. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.